Hello and welcome to another episode of A Journey in Boots from Trauma to Triumph. I'm your co-host Dorothy Odell, and I am the owner of Unstoppable Overcomers Productions. We are set out to become one of the largest media companies in the world. That's what I'm declaring here on the show tonight. We help the average business person be seen, heard globally. Not only that, we have our own Roku channel as well. So go check us out on Roku at Unstoppable Overcomers, and of course our YouTube channel, Unstoppable Overcomers, as well. Subscribe, share with your network. We'd love to have you join us over here on this amazing adventure. And now, Dr. J, over to you.
Hi, I'm Dr. J. Royster. I'm a licensed mental health counselor, industrial organizational psychologist, and many other hats. But today I am co-hosting with the lovely Dorothy, and we're bringing you a pretty cool show. But I do want to say that I had the opportunity to have Dorothy in my home last weekend, and she gave me a book. It's called The Overcomer. And I did not know she was a published author, but there were chapters in there. It's a quick read. It's not very thick. So I read it in about an hour and a half. There were a couple parts in here about the expectations of others, how to let things go. And she talked a little bit about her trauma, which is actually my specialty. So I was very enlightened by her perspective and her journey. And it's actually signed. So I just wanted to say, read The Overcomer. It's a quick read, but it has very good nuggets of information in it. And I'm going to help her sell some books. So yay!
Yay! Thank you so much. Yeah. Now she's like, now I know why she's the way she is.
Yes, exactly.
Dun, dun, dun. Anyways, before we bring up the amazing Dr. McCarthy, let's give her, or should we bring her up and then introduce her? Or yes, bring her up. All right.
Yes, it makes her very uncomfortable. I love it. Talk all about her.
Perfect.
See?
Dr. J loves putting people on the spot. I just absolutely love it. All right. So I'm going to read a little bit about Dr. McCarthy's bio. I'm not going to read the whole thing. We'll be here all night long. This woman is definitely somebody you want to get to know. She is board certified in physical medicine and rehabilitation, as subspecialty board certified in brain injury medicine. She received her acupuncture training at the Helms Medical Center and is a certified battlefield acupuncture instructor. She treats the elite special forces for the United States Special Operations Command and Special Operations Command Center. She is a program director for the University of South Florida Physical Medicine and Rehabilitation Residency Training Program. She holds an academic appointment in the University of Southern Florida in the Department of Neurology as an associate professor. She serves as a medical director at the James A. Haley VA Polytrauma Traumatic Brain Injury Input Unit. Wow, that's a lot.
And she sleeps 9 hours a night. This I want to know about. How?
Do this? Exactly.
It's like USF is a Monday, whatever. I'm like, oh. It's amazing.
So I could go on forever, but I like to bring people up and I like them to share from their heart. So Dr. McCarthy, share with us a little bit about why you got into medicine. Like why did you start this journey?
Okay, so why I started and where I am are two totally different things. When I was 14 years old, my grandfather was diagnosed with prostate cancer. I did grow up in a medical home. My father is a retired general surgeon. But when I was 14 and my grandfather, he was diagnosed pretty late. It had spread everywhere. And he took us on a family trip to Israel, where we stopped in Rome and then we went to Israel. We met family there that didn't speak English and we don't speak Hebrew. And we literally had a meal where we all just smiled at each other.
That's
and
awesome.
Then I remember being on that trip and feeling very grateful, that he had given us this gift of travel and family and fellowship. And my grandfather was a principal. Before he was a principal, he was a history teacher. So he and my grandmother were extraordinarily obsessed with education.
Mm.
And when he passed, he actually left his 5 grandchildren an education fund. And I didn't know about it, until much later, when I was going through college. And then, all my mom was actually in control of it, never really told anyone. And until I needed it. And
Is
then,
this your mom's mom?
no, this is my dad's mom. They put her in
Really?
control because they felt she would be equal and fair.
Interesting.
Mm-hmm. So anyways, I thought I wanted to do cancer research, and fix whatever it was that was wrong with Poppy. And,
Right.
As in a 14-year-old mind, that's where I went. Lo and behold, 3 years later, I'm 17. I'm trying to figure out where I want to go, what I want to do. I for sure wanted to get out of Florida. I wanted to go to the Northeast, go to some, really cool liberal arts school and wear Birkenstocks or something. And
Your mom is an art therapist, right?
my mom's an artist, yes, and
Okay.
she does, yeah. So I had both sides. I have the art and science, growing up, but there was this program at University of Miami. My mom's like, apply, and I'm like, I'm not staying in Florida. I got to get out of here. I've been here my whole life. I don't want to be here. So I literally, piecemealed applications from other college essays and questions, and all of a sudden, I get into this program at University of Miami. Lo and behold, it's done in 6 years. You get your BS and your MD. And how could you pass that up? Oh, and by the way, I got a full scholarship for the undergrad part. So, how could you say no? But stuck in Florida again. Although I will say Miami is like on foreign country. Okay.
Yeah.
It's like totally different than, where I had grown up. So I end up down in Miami. I, do my 2 years of undergrad and then my 4 years of med school. My 4th year of med school, I was like, I don't like anything. What am I going to do? Here I had made this promise. I'm going to research cancer. I'm not doing that. I'm going to be a doctor, but I don't really like anything. What do I do? Right. So I came home to Tampa for a month towards the end of my senior year. And my friend's father had a practice here doing physical medicine and rehab. We didn't have that at Miami, so I had no exposure to it there. So I was like, hey, any chance I could hang out with your dad for a month and see what they do? So I ended up at Tampa General Hospital, which is a level 1 trauma center here in Tampa.
Mm-hmm.
I ended up shadowing a lot of the doctors from pediatrics to adult, learned all about the rehabilitation process, how it's a team, the patients in the middle, and then all the different providers work together to get the person better or as independent as possible.
That's a hell of a on-the-job training.
Yeah. I mean,
Good Lord.
But at the same time, not the doctor's kind of the captain of the ship, but you have all these people, that are around you to support, the elements of getting this person better. So then that was like light bulb. Okay, I'm going to do this. No problem. We got this. No problem. So then I'm like, okay, where am I going? So then you start looking all over the country. What has the best, residency training program for this? And don't forget, oh, by the way, you have to do an intern year. Pick one: medicine, surgery, pediatrics. And I was like, oh, what am I going to do? Because I didn't like any of those things. So I ended up choosing medicine. I decided to do my intern year in New York. I had a great experience, actually. It was a community hospital, St. Vincent's. I ended up getting married that year in New York, which was great because my family could come, my husband's family could come, and we were very centrally located for everybody to get there.
Mm-hmm.
And then I ended up matching for my residency training at Baylor in Houston, Texas. Never been to Texas in my life. Another new adventure, right? I had never gone west of the Mississippi ever. Okay. So, and you get there and really there are cowboy hats and open carry and the whole
Opening
you imagine
doors and yes, ma'am, and no,
right?
ma'am. Yeah. Very different experience.
But the medical center training at Baylor is like incredible. It's not, it's like now, I think like Abu Dhabi and Dubai, those places all like model after it. A lot of Mayo Clinic influence. So I go there, and I do the, the residency training for physical medicine and rehab. But let me rewind. Okay. 2001, everyone knows where they were on 9/11. I was in medical school. We had like a floor where you would get your mail and you could just kind of meet with people in between classes. And same grandfather, the one that passed away, left my grandmother. I'm not kidding you, maybe 3 blocks from the Twin Towers. Okay.
Oh my.
So,
Wow.
as everyone knows, you have goosebumps right now thinking about it.
Yes, I actually literally do.
And in 2001, what was your cell phone like? Not like it is right now. And most people had landlines.
You had a cell phone?
No, I had one of those Nokia flip phones at some point. I don't remember what year.
I remember those.
Right? Where you had to do like A, B, C, D, E to text.
Yes.
But anyways, I remember trying to call my grandmother. No one could get through. My dad couldn't get through. Like nobody could. And the feeling that had, and that's when I think a lot of people decided to sign on the bottom line, enlist, whatever case may have you. So, and even in medical school, that is an option. You can, most of the branches of the armed forces will pay for your medical school training, and then you owe them a certain amount of time after
8
you're done.
years.
There were several people in my class that did do that. So I will tell you, I personally didn't feel that I could serve my country in that capacity, but at that point, I made a promise to serve them, to take care of the people who had been injured. So that was when I decided that I knew I wanted to work with veterans. So even before I picked what specialty I wanted to do, I knew what population I wanted to work with.
Because we're awesome.
Right.
Love how she says that. She's like,
Right?
I mean,
I agree wholeheartedly.
Yeah. So then I do my training in Houston, and we did have a lot of VA exposure. The Michael E. DeBakey VA is a very large VA hospital. And I got amazing exposure, not only to traumatic brain injury, spinal cord injury, amputees. And that's really what we deal with, mostly stroke patients. So I felt very comfortable working with that population. And then when I was graduating my senior year, I had just had my first child at the end of residency. A friend of mine shows me this article about how they're looking for a brain injury doctor at the Tampa VA. And I'm like, are you kidding me?
She goes right back home.
Right? I was like, I'm never going back to Florida. Okay, wait. Mom, I need help.
I fail to see what's wrong with Tampa. Like, seriously, I was just there.
Nothing wrong.
It's
We have
like
everything. I think it's just when you've never been anywhere else, you want to go somewhere else.
True.
So, I come and I interview at the Tampa VA, and I love it. I love the people that I meet, and turns out Tampa VA has been named one of the 5 polytrauma centers in the country to take care of any active duty or veteran, that was injured post 9/11. So with this big brain injury unit, and when I first started there, like the catastrophic injuries that we were getting were unbelievable. You have the MASH unit where everything happens. Then, they get to the Air Force base at like Bagram, and then they go to Launchstool, and then they go to Walter Reed or Bethesda, and then they would come down. Now it's all one, but at the time it was 2 separate. And then they would divide them among the 5 polytrauma sites based on where they were from, like their catchment area. So we were the whole entire Southeast. So I didn't dip my toe in the water. I jumped in a cold plunge, straight out of residency.
Which cold plunges are good for you. I'm just
but when you're in them for 16 years, not 16 minutes. I had an interview with the chief of staff, and he kept saying to me, "How thick is your skin?" And I'm like, is this like a test? Like, why is this guy asking me this? And my only response at the time was thick enough, like, I don't know what to say. And he's like, all right. And then, come to find out, a lot of the injured people's families would be highly involved, or they were families that no one ever knew existed that all of a sudden came from the woodworks. I'm the sister, I'm the mom, I'm the wife, I'm the whatever. And then as the provider, you're stuck in the middle.
Right.
And now you've got this severely brain injured person that does not necessarily have the capacity to tell you how they think, what they think, if this person really is related to them or not,
Right.
and if they want them involved in their care in any way, shape, or form. So we became known as the polydrama unit instead of polytrauma. So that was definitely a something you could never plan for.
Right.
So stress, yeah. When I first started, it was a whole new animal, and it's different than stress from studying for a test, or stress from, maybe your marriage, or stress from finances. This was like a whole nother outside stress, work, but also, trying to disconnect yourself from what happens during the day and be able to go home and be present for your family.
Right. I have 2 questions for you.
Go ahead.
First off, in med school, do they give you any leadership skills? Like, you have a lot of residents underneath you, and you lead a monster team in both you're as a professor and at the VA. So because you have 2 jobs at stuff. So how do you are you taught leadership skills? Like, how did you come to be?
So in medical school, so pretty much the first 2 years are classroom and the last 2 years are clinical.
Mm-hmm.
So classroom work would include some forms of leadership development. I mean, we had a course called On Doctoring.
Okay.
We also had courses on being able to never be shocked. I'm sure you had that as a psychology student, right? Like, so that someone could tell you something and your jaw doesn't drop open. Like, what did you just say? So I think that, but I wouldn't say there was any formal leadership training. Once I got to residency, they offer that for those that are interested in being a chief resident. And then through the university, they have leadership development courses all the time, as does the VA. I will say, state and federal institutions do a really good job of offering continuing education in whatever area you're interested in. So if you feel like you're going in a leadership track, you can definitely tailor your education needs to that, depending on what you want to do. But I also think, I didn't grow up thinking I want to be a leader.
You're just stuck being one.
Yeah, that definitely wasn't in my. It wasn't in my vision, I guess, as a physician. And it's definitely taken on another role that I never thought I would have. I always tell people I have 4 biological children and I have 12 adult children, all over the age of 25. And I'm 24/7 for them and mine, obviously. So one of the other things I think is really important as it relates to leadership is treating those that you work with closely like family, because being a resident
with boundaries, though.
Oh, absolutely. But at the same time, the reliability, being there for someone when they need it. No, I don't go out, drinking with my residents or like partying with them or anything like that. I'm saying more in the sense that they feel comfortable coming to me with something that needs to be addressed versus, hiding it or lying about it. Same thing I tell my children. And not but 4 nights ago, my daughter called me at 10:30. Mom, I'm at a party and the cops came. Can you come get me?
Oh, wow.
Wow.
Mm-hmm. But I'm glad she called me. And I'm glad she felt comfortable to call me. So
that's amazing.
Mm-hmm. So that's my leadership style, I guess.
Funny you know that. We had one rule in our house. I don't care. You can go out and drink, but you call me for a ride home. I don't care what time of day or night it is.
Yep.
My brother would use that more. I used it once, and I was actually an adult when it happened. And he
Mom,
called me. He called me at 3. He called us at 3:00 in the morning. He was in a town. It took us 25 minutes to get there. The kid is drunker than a skunk, and he keeps calling us. Where are you? Where are you? I'm like, you called us literally 2 minutes ago. You got to give us time to get there. Gets there, can't find his truck, can't find nothing. But anyways, that was the one rule we had in our house.
That's a good one. That's a good one.
That didn't make it to the book, but now you know something.
No, you reminded you of it though.
Well, the book is about you, so just saying, I'm gonna spot her again. It's awesome. I think it's great. I've been working on my book for a year. Like, I'm getting there.
And need I remind? Yeah, that was like the first attempt at being an author ever. And actually, Dr. J has the original version. Yeah. There is a new version out, which is on Amazon.
Oh, nice!
Like it's signed and everything.
I love that. How do I get one of those? I guess, can I order it on Amazon signed?
Yes, you can order it on Amazon.
That's awesome.
But yeah, that's it's funny because usually when we go through something is where our life takes us, right? And I mean, it's sad that your grandfather was ill, but at least that pointed you in the direction. And then another tragedy like 9/11 was like, no, this is where it's at. This is what I really want to do. But
weren't you younger than everybody else when you started your residency though?
We're called baby docs.
Yeah.
Dewey.
Challenging.
Mm-hmm. And
that's why I asked you about the thick skin.
So also in medical school, you have tests every Monday. So your weekends suck. You're studying all weekend, but Monday nights, that was where the fun was. And in the United States, you have to be 21 to drink. And I was 20 when I got to med school. So I had no older siblings. I had no reason to be out. I had several fake IDs that were taken from me. And there was a point where I was like, I'm not, because I wanted to go out and have fun after studying all weekend and, hang out with my friends. But that was definitely a little difficult at times, just because I was a lot younger than everybody else was.
Yep. Bike drop.
I forget this is a podcast that it's going to be on Audible. So I have to work on inserting, sometimes you just say things and it resonates and I'm processing it, but I forget that it's going to be on audio too. So we have to fill in. We'll get better at it.
You
this
don't have a way to edit.
So right. It's all good. You're better live anyway. I've seen you present, so I am not concerned. I'm more concerned with us being able to fill.
No,
it's a process. We're working on it. We're still in the baby stage. So
yes, baby stage. And
when you started with traumatic brain injuries and CTEs, can you tell us more about that? Because, they talk about football players having, Aaron Hernandez and people like that. They don't really, when people go, oh, I have a TBI, people don't understand.
Right.
Don't understand that I can have a traumatic brain injury as I sit here and speak to you.
Oh, yeah. I mean, so TBI, traumatic brain injury, was coined the signature injury of the war, actually. And I don't think it became as such a hot topic, not even in the military space, but even in the professional sports space until the last 20 years. But it's been going on for decades. And only now are they starting to get the right type of protective equipment to prevent people from getting it. So mild traumatic brain injury and concussion is exactly the same thing. Anytime there's a disruption, physiologically in the head, your head rocks forward, your head rocks back, you had a brain injury.
Really?
Pretty plain and simple. Think about all the times you fell as a kid. Think about all the times, you hit your head against a wall or the trunk of the car, or, what makes one worse than another. What happens after the first 24 hours is your brain releases almost like a histamine, like an inflammatory cascade, right? So all these excitatory neurotransmitters get released. And depending on how severe the trauma was, kind of dictates what the injury looks like moving forward. There's truly something called second impact syndrome, meaning if you get 2 concussions within a 10-day period, it can actually lead to sudden death just from the sheer fact that you've had all this like transmitter release in such a short period of time without a time to recover. And that's one of the biggest misnomers about brain injury. You don't have to have any imaging finding on a CAT scan or an MRI. It's all clinically based. I hit my head, I got a headache. You had a concussion. I hit my head, now my vision's blurry. You had a concussion. I hit my head and then I threw up. You had a concussion. I mean, so think about how many concussions you may have had in your lifetime. It's probably more than one. Now, our weekend warriors or football players or soccer players or, whatever professional athlete, they get them during training, they get them during games, they get them during off season. And a lot of times they minimize their symptoms because they want to keep playing. Mm-hmm. And then what happens over time is they have this cumulative effect of what we call subconcussive blows over and over and over and over. And then 10, 20, 30 years down the road, now we're starting to see memory impairment, mood changes, personality disorders, things that we may not have seen had they not had multiple concussions, week after week, month after month, year after year. If we had given them the time to rest and recover, could we have avoided, what we're looking at now? As with most things, we don't know the problem with the exposure as it's happening. We only come to know it, 20 years later when we start to see the results and the ramifications of it. So what can you do? I mean, beyond the protective gear is really, now we have these very specific return to play protocols, and we start them out very young, even in middle school athletes. So what I do at the concussion clinic, whenever I say child, I see children 8 and up. When a child has a head injury, even if they were sitting in gym class and a basketball hit them in the head, and then they fell,
dodgeballs,
they couldn't concentrate. They had a concussion.
20 of those.
Guess what? They can't play their sport the next day. We have a full return to play protocol to prevent them, from having, all these problems related to multiple concussions. Let's take the military population. Even being exposed to rounds of artillery rattles your brain inside your skull, even with ear protection. Right. So, and it doesn't have to be, being blown up by an IED. It doesn't have to be, falling out of a Humvee. I mean, it's very easy to get a brain injury, but it's also very easy to recover if you do it correctly. Right. And most of it is patience and time, which no one wants to do. Truth be told.
So I have a question. So I have we'll call her for lack of a better sake, a niece that plays hockey. And to my understanding, she's had so many concussions, she's losing her eyesight. And she's less than 16, I believe.
Wow.
So how it can that damage be reversed?
I would say 2 different ways. So if she's truly had eye trauma, because in hockey that could happen, if she was hit in a certain way, where perhaps either the socket in which the eye is in or the eyeball itself was affected, or believe it or not, the back of the brain, your occipital lobe, is responsible for your vision. And then there's an octave chiasm in the middle. So there's a lot of different areas that could be injured in hockey. Hockey is a pretty highly concussed sport, in addition to football and rugby and soccer. Right. But, not really knowing everything about her, she kind of has a couple different ways of having issues related to vision.
So that could be reversed, though,
depending on what the injury is.
Right.
So there's also something called the vestibulo-ocular reflex, and that's how your eye and your vestibular system, which is your balance system, communicates. And a lot of times that's disrupted in a concussion too. So there's a specific therapy for that. Not only do we do vestibular therapy, we also do vision therapy.
It can include therapy Break this down to layman people, not just
layman people. So vestibular therapy, you know, like when people feel like the room's spinning, they have vertigo.
Okay.
There's different reasons you can have that. A lot of times it has to do with crystals in your ear being dislodged. Yeah. In your little semicircular canals inside your ear, you have little rocks or crystals. And from a trauma, they can get jolted into a different canal. And then you'll see people's eyes either going side to side, up and down, or in circles. That's called nystagmus. And that's what happens after head trauma. So vestibular rehab is done by a physical therapist that's specifically trained in that. Not only do they help put the rocks back in the right place, they work on how your visual system and your balance system connect.
Wow.
It's a very nauseating therapy. I'm not kidding. Like even to do it without having a problem, you know, it's rough, but it works. And then vision therapy is more specific to help retrain the muscles of the eye, especially if they become off balance. Same thing. Think about a trauma. If your eyes are completely level and now one's slightly higher than the other, and you can't really correct that, like anatomically, you have to correct it with the muscles in your eyes controlling the movements. Yeah.
Fascinating.
So when you tell somebody you got rocks in your head, that's actually really something.
Totally.
Totally is.
Totally.
Yes.
Damn, my brother. That explains so much.
Yeah.
Back to what you do, because I know you do legal medical work too. So on because she's bored on Sunday apparently, but like USF, you teach as a professor and you work in one of their clinics and you work at the VA.
Right.
Okay.
Correct.
So what do you do at the clinic at University of South Florida?
So that's the concussion clinic. Okay. So a lot of times I'll either get the student athletes or anyone, civilians who've been in car accidents, falls, domestic violence. It doesn't matter how you got your head injury. I still have to see you.
So tell us about a successful case.
There's so many.
Just one big.
Oh my gosh.
One.
You know, people always say, how do you do what you do? And then I say, well, how do you do what you do?
We don't do what you do though, man.
I mean, really. I would say, oh gosh, the most successful cases to me are the ones that come in what we call a minimally conscious state, where they're not in a coma, their eyes are open, they might be looking around the room, but they don't speak. In order to become vegetative to minimally conscious, then you have to start tracking within the room and kind of notice people. And then to emerge from that state, you have to have functional object use, meaning somebody gives you a cup and you bring it to your mouth, or they give you a hairbrush and you brush your hair. Now we know there's an awareness piece that wasn't there before. And there's a scale that we use to kind of see the recovery process happen. And what happens is something called neurogenesis and neuroplasticity. So you're making new brain cells and you're making new pathways to route around the areas that are damaged. And it happens. It happens with patience and time. It happens with reducing inflammation. It happens with sleep, my favorite thing. And it happens.
We're going to talk about that. Don't worry.
And so watching someone go from completely dependent in a vegetative or minimally conscious state to walking out of the hospital, talking to their family members, to me is a success.
That is awesome.
That is amazing.
Yeah.
So I think we often get publicized for negative things, and we tend to not celebrate the positive things that happen. So I would say as a provider, I hang on to the positive.
As you should. How long would that time frame be from the time they came in like that to the time they leave walking out?
It really depends. Some people emerge very quickly and some people can take months.
But months
and some never emerge.
Right.
Yeah.
So, those are the ones you probably hear more about. Unfortunately, but the brain is an amazing organ. It is a lot like the liver in that it has this ability to almost regenerate and fix the areas that are not functioning properly. And I think that we only know 1/10 of what the brain can do. And at the same time, the brain controls our entire body. Everything from breathing to sleeping to movement to thinking to memory to creativity to, a vision. I mean, everything that we do all comes from the brain.
It's amazing. So let's talk about sleep.
Okay. I love sleep.
I know.
I love sleep. I do sleep 9 hours a night. When I don't sleep 9 hours a night, I'm not happy.
What time do you go to bed and what time do you get up then?
Usually 10:30 to 7:30.
Oh,
Yeah.
okay. That's not too bad.
It's not. It's totally doable.
I'm the type that gets up at 3:45 every morning, and I'm in bed by 9 usually though.
I go to bed when she wakes up. I have terrible sleep, but it's much better than it was. I will tell you. But she has a regimen, and she makes me take it, and she holds me accountable. So I do get sleep when I do.
Yeah. I see, and I actually even know when I'm not going to have a good night of sleep. I know when I lay down what's going to happen. So I always say consistency, having a bedtime and a wake up time that your body gets used to is number one. And when I err in either direction more than an hour, I'm done. My sleep is wrecked for the night. I know that for me. If I don't take a shower before bed, I'm done. It's like it becomes a ritual. And that now that I have 4 children and I understand sleep training, I know why. Like there are certain cues your brain needs to know, hey, it's time for bed.
Right.
You're tired, get up there, do your routine, take your shower, brush your teeth, go to bed. So I've learned that over the years. I also did my own little self-study while I was in medical school. I would take a test. I would stay up all night like everybody else and cram, and I would take a test. Or I would study during the day, go to sleep at 10, wake up at 7, go take my tests. I always, 100% of the time, did better when I slept the night before versus staying up all night and cramming. Because when you sleep, you consolidate your memories. So anything that you read will be locked into that little special part of the brain that's going to allow you to regurgitate it the next day when you need it. So now it makes sense.
So is there a time, like a lot of people, I work with a ton of people who have sleep issues, and, since you've given me your secret sauce, I share with the world. So, how do you guarantee you hit REM?
So, the only way, I think we've talked about this before, the only way to know that you actually do is to have a sleep study, like a full-on sleep study in a lab. Even with the wearables, they have algorithms that are akin to what it would be like to be in REM, but not actually monitoring it the way that you would if you had an EEG machine and a heart rate monitor and a pulse ox going on at the exact same time. Okay. So wearables are great. They're a good alternative to not having a full-on sleep. And you're not going to be in a sleep lab every single night of your life either. Right. Sleep labs are good really to diagnose things that need medical attention, like sleep apnea or restless leg syndrome or some other type of parasomnia.
Are all of those things I have? Yeah.
Great. What was the other thing you guys were talking? The paralytic sleep. Everyone in the room said they had it. Sleep paralysis.
Yeah, sleep paralysis. Yes.
I was like, I've never had that, but everybody else in the room has had it. I'm like,
we're all trauma counselors. It happens.
I haven't had enough trauma.
That's a good thing. Don't go looking for it.
Yeah, don't go looking for it. Good.
I'm like, why haven't I had that before?
Yeah. That's a thing.
I know.
So what's sleep paralysis then for those of us that have no clue what the hell that is?
You Dr. J.
Oh, no, you're
No, it's you. I've never had it. It's like you're there and you can't move.
Yeah, pretty much. It's sometimes it happens after having nightmares, but most of the time it happens in your subconscious where you're cognizant and you're awake and you're like your frontal lobe is on fire, but your body isn't moving. So it takes, now sometimes it comes back right away. And sometimes you lay there for 5 to 7 minutes and wait for your body to respond. And so that you can get up and get out of bed. But it is terrifying the first time it happens. After a while, you're just like, meh, I'm just going to chill for a little bit until my body wakes up. And I just kind of put it in my mind that that's what's happening. I'm not looking at it as some, oh my God, my body is paralyzed. It's just my brain sometimes takes a few minutes for my body to respond and move as quickly as my brain does. Does that make sense?
Yeah.
I don't look at it as a traumatic event anymore.
So background, if in fact you were actually sleeping and your eyes weren't open and you were having a dream, you would be paralyzed, which we've talked about, because in stage 5 or REM sleep, when you are dreaming, your muscles are paralyzed.
Right.
So that you cannot act out your dreams.
Right.
So if you're running from a tiger, you're not actually running while you're sleeping.
Right.
So that's basically what it is. It's just in her situation, she's now woken up, but she's still paralyzed. So it's almost like you're still in REM, but now you're awake.
Right.
Wow. Okay. So that's happened to me a couple times.
See?
And I could not get, I could not, my eyes would not open. I tried. Like, it was horrific what I was dreaming. And I thought somebody was actually in my room coming to get me. And I could not wake up no matter what.
Wow.
Yeah. I've had all of that drama.
I have one of my kids has, I guess they're night terrors. She'll wake up and she'll kind of march around in circles in her room, and she'll be like, but you could have like a conversation with her. She's awake and she's walking in a circle.
So she's
and then I put her back in bed, and then she doesn't remember it the next day.
So the other question my clients have asked, because I told them I was going on a podcast with you, so they had questions. But when you're laying in bed and you're just about to fall asleep and you have this, what is that jerking motion?
Oh, that's stage 1 and 2 of sleep. Your muscles start to twitch.
But that extreme?
No, it's not a dream. It's just that you're
that extreme.
Oh yeah,
that jerk.
Oh yeah, because you're about to fall asleep and then something woke you back up, so you jerk. Whether it was a noise or something came into your thought, or someone opening the door, somebody moves. Yeah,
I'll let them know.
That's normal.
They were asking.
Totally normal.
A lot of people who come to therapy are, instead of going, hey, I got a problem I need to work through, they're going, something's wrong with me.
Right.
Not always the case.
Right. Exactly.
Nope, you're normal. Sorry.
Yeah.
But I do say normal is a setting on a dryer. So I don't like to.
I don't have normal on my dryer.
Right.
Right.
You don't? Well, you're fancy.
No. Oh, I just got a new one. I really don't know how to use it, but
Make your husband do all the laundry.
Yeah, it might say. You know what I think it says? Mixed loads.
There you go. No worries. She presses the start button. That's what she does. He's fancy. It's all right. You've earned it. It's okay. We forgive. So as far as sleep hygiene goes.
Yes.
And the schedule, but you also have additional little
nuggets. Do. Okay. Number 1 is consistency. Here we go. Number 2, you have to exercise, but not within 2 hours of going to bed. Okay.
So my buddies who get done with clients at 10:30 at night and they head to the gym, that's bad, bad, bad. Yes.
If they want to go to bed by midnight, yes, it's bad.
Thank you.
Bad. No heavy meals before bed. So I always say within 3 hours. And that's not because food isn't going to prevent you from sleeping. It's reflux, heartburn, indigestion, all the things that happen if you eat a big heavy meal and then you lay down. So it's not that you can't eat. You can eat if you want. But it's not, that's what's going to affect your sleep. Blue light exposure. It's not that the blue light is bad, but it's the fact that you're not shutting yourself down in the way that you should within the hour of going to bed. Like texting, watching a show, watching a movie, reading on your Kindle. So I always say, like, try and stop that within an hour of going to bed.
So if
Oh,
you're
my.
planning on going to bed at 10:30, you need to shut down by 9:30.
Yeah.
Okay.
And what you should do is read a real book with like actual like print.
You know, this one.
Yes. With a dim light behind your head. You could read that and go to sleep.
Okay. I keep plugging Dorothy. She's loving
Yeah.
it.
People that sleep with the TV on don't have as good sleep. You need a cold, dark room. And we always say between 67 and 69 degrees, which requires a very high electric bill in Florida.
Yeah.
Very hard to get your house at that temperature.
74 with a Dyson fan. That's
Well, you
my
could do that too. So fan or white noise, those are options. Some people use essential oils. Like I said, having a ritual where like you do something before you go to bed.
Mhm.
Stop caffeine intake by noon if possible.
Oh,
I
that's not
know.
gonna happen.
What did I say the last time? 1 cup of Starbucks. 1 cup takes 23 hours for your body to eliminate.
But it's so good.
What about a Dr. Pepper?
So, yes, any
Hey.
dark soda has caffeine. So does chocolate.
Look, Dr. McCarthy's been
so-
on me for 2 years.
So to go to bed with a Dr. Pepper should not be.
Should not be. I do
take
ginger
water
ale.
too. I take water. up
That's
there.
my drink of choice. Ginger ale.
Okay. That's a good happy medium. I'm good with that. Ginger ale. I
Okay.
can do that.
Okay. Ginger ale 0, no sugar.
What?
Yeah, no
But
sugar.
I love sugar.
But this tastes really good. Try
Okay.
it.
All right, I'll
I
try it.
recommend it.
I'll
It
try
is
anything. Look.
Yeah.
So the
But
vitamins.
then
Talk
what-
about
go
the
ahead.
vitamins.
The vitamins. So there's a couple that I highly recommend. One specifically is magnesium glycinate. Take 300 to 400 milligrams half an hour before bed. This
Yes.
helps with sleep, anxiety, muscle recovery, and headaches.
Sleep latency too. It keeps you asleep,
Yes.
which is the strangest thing ever. Because I have no problem crashing. I crash
Right.
hard. I'm in deep sleep 33, 35%. Like
You just have
I
trouble staying asleep.
die.
Yeah.
Yes. 2:00 in the morning. I'm like, what's up? Yeah.
Time to party.
Yep.
So I also tell people when they wake up in the middle of the night, where's your book? Bring it up. Show the book again. There you go. Okay. Open up your book. Put that dim light behind your head. And then read until you doze back off to sleep. Make sure you have a bookmark.
Dorothy, pull yours up because that's the one they get on Amazon.
You can read that too if you wake up at 2 a.m.
It's The Overcomer by Dorothy Graham Odell. You can find it on Amazon.
It's actually The Overcomer Facing Challenges with Faith and Courage on Amazon.
There you go.
I'll put a link in the comments.
Yes, please. And on YouTube.
Yes, I will do that. Just give me a moment.
See, she knows how to do all that.
Nice.
Like my Zoom is my phone number because I have no idea how to do this stuff.
At least you got a Zoom.
That's true. Well, you see people in person.
I do. I actually do some televisits. But
Okay.
they set that up and they bring the iPad in. The person's already on there. So all I have to do is say, hi.
Here's your 15 minutes of fame. Ready?
Yeah. For the ones that's far for them to travel. we do
So,
that.
as a physician, like, how do you feel only meeting with someone for 15 minutes? Like, do you is it enough for you?
It depends. And my visits are actually 30 minutes.
Yay.
I built my schedule that way so that I could, give them the time that they need. Obviously, the first time you're seeing someone, I think it requires a bit more time to get to know the person. And then for follow-ups, it's definitely more specific to whatever it is that they want to talk about. So maybe the first time they came in, they were having trouble sleeping or they were having headaches. And then the next day they come in, they're like, you know what, my headaches are all better and I'm sleeping really good. But, my vision's blurry. So now we're going to address, the vision issue. So it doesn't necessarily take that much time when you're like kind of targeting, the little issues that may come up as it relates to head injury. And like I told you, that was a severe case that I mentioned, going from minimally conscious to walking out.
Right.
95% of mild head injuries recover. So your odds are very good.
That is awesome.
So, it's just a matter of, rest and reassurance too. I think a lot of times people need to come in and hear that so that they don't think, what's wrong with me? What's wrong with me? What's wrong with me? You know, and a lot of times just knowing that you will be better, you're going to get better.
I get that too, because people seem to think they're defective, and it's like, no, this is what happened to you. This is not what's wrong with you.
Right.
So you always have to like separate that. But
and there's a nocebo effect. Have you ever heard of that versus a placebo effect? So a lot of times, like the negative thoughts, you know, will produce negative outcomes.
Right.
Whereas positive thinking is, you know, is going to make a big difference. It really does. And as you know, I love to laugh, and I truly believe that laughing and humor is a form of medicine. A lot of people will isolate themselves and get depressed and, you know, think something's wrong with them. And then they'll come see me and I'm like, when's the last time you went out with some friends? When's the last time, you know, you had a good belly laugh?
Yeah.
Okay. Let's start there. And lo and behold, sometimes they also need
that release in the brain.
Yeah, for sure.
Which one?
Dopamine.
Yes, which is the
addiction hormone.
That's not where I was going, but yeah. Oh, tell us a little bit about dopamine, cortisol. We hear all these, but I don't think people know what they are.
So there's a lot of different neurotransmitters in the brain. I would say the biggest problem that we have is that we don't know how to measure them. We can't do a blood test and be like, you're low in dopamine. You're low in norepinephrine.
Everyone's low on dopamine. I will say
you're low. And, you know, it's not a blood test that we can do. So then what happens is they go and talk to a psychiatrist or a primary care doctor, and they're like, you need this, you need this, you need this. And then they start throwing medication at them. Yes. And, you know, they end up feeling one way when that's not the effect they were hoping for, because they weren't correct in knowing which levels were high and which levels were low. And every brain is different.
Yes.
Everyone responds differently to different things. Right. And there is a trial and error. When you do choose to go down the prescription drug route, it is a trial and error. And you have to know that going in. Because what make one person feel really good make another person, you know, extremely depressed. So cortisol can be good, and it can also be really bad. Like, you need a certain level of cortisol to be productive. They call it it's part of the adrenal glands, right? Mm-hmm. Part of that fight or flight. If your cortisol level is always high, you're always in that fight or flight mode. That leads to a lot of chronic medical issues, like we call it metabolic syndrome, central obesity, high blood pressure, heart disease, stroke, diabetes. All of that happens.
Anti-inflammatory diseases.
Exactly. And we always say when the cortisol level is high, like, you're slowly killing yourself. Similar to not sleeping. You know, if you're not sleeping, you're slowly dying.
So how do you check for your cortisol level, and how
that you actually can check? So there's an AM blood test that you take exactly at 8 a.m. and then another one at 8:30, and that can be ordered by your physician. And if your cortisol levels are off, there is specific. I like to use supplements, but there are ways to help lower your overall cortisol level. But there's also natural ways like deep breathing and sleep and, you know, meditation and yoga.
Reducing your stress and self-care. And
exactly.
self-talk.
But some people just want to take a pill and they don't want to do those things. And that's okay. True. Yep. You know, that's okay. If that's what all that fits into their life, that's their choice. There's one called Cortisol Calm I really like. It's made by Pure Encapsulations. No plug-in for them. I don't. I'll work for them.
Go to Raven Health.
Right? I mean, there's a lot of different supplements out there, but they'll even say like cortisol lowering or ashwagandha. That's another one that will help lower your cortisol, helps calm.
Okay.
There's another supplement I love that naturally raises serotonin. It's called 5-HTP. It's a precursor to serotonin. So if you think your serotonin levels are low but have no way of knowing and you want to try something.
As in the number 5?
Number 5 and then
5H. TP.
Yeah. Yep. That helps raise your serotonin levels.
I have a lot of clients who struggle with low serotonin levels.
Yeah. Yeah. And I feel like, I mean, obviously based on your scales, like when you do like anxiety and depression scores or things like that, it can lead us to believe the levels are low, but we don't actually know because there's no way to test it.
Right.
So it's just more based on what they're telling us.
That's interesting.
Yeah.
Yes. There's no dopamine drug, huh? Other than
There-
Xanax.
No, well, there's L-Dopa.
Just kidding.
Mm.
Xanax is not good.
So dopamine, obviously, in Parkinson's, right? There are medications that we use to target the dopaminergic pathways,
Okay.
as well as the receptors. So in that situation, we're trying to get the dopamine to attach back to the receptor so that we're not seeing that, a lot of times they'll have like stoppage in their gait, like when they're walking or in their speech. And that's because there's a disruption in the dopamine pathway. So there are what we call dopaminergic medications, but they're not typically used for people that just have low dopamine. They are more designed for people with either Parkinson's disease or some other type of movement disorder.
Okay.
Mm-hmm.
Awesome. So what is next for you? Because
what's next?
You're already doing everything. So,
I think in my 40s, I have found a good work-life balance. I know it sounds like I do a lot, but I would say efficiency is my strong suit. I'm kind of able to multitask as most women are, so that we are able to accomplish, what we need to do in the day for ourselves, for our families, for our career. I do take time for myself. I go get my mani-pedi. I don't miss it. I will go get a massage every couple months. I will go to the beach. I just went skiing. I definitely make sure that, I incorporate good leisure activities in my life.
to benefit of the minions, because the minions
Right.
definitely
because when you go home, the work starts.
Right.
Which is why I'm here in the dark at my parents' house. I don't even know how to turn on the light in here.
Your skin is glowing. So that's
is it?
matters. Yeah. So what is Raven Health?
So I started Raven Health during COVID. So my middle name is Ray, R-A-E, right?
Okay.
But as you know, Raven's a bird.
And she's got jet black hair. So
and I have black hair. Yeah. And everybody wants to fly, right?
Yeah.
So what I did is I established this LLC during that time to kind of do telemedicine to help people with brain health and fitness, because of the fact that we were all kind of stuck at home and, no one really knew what to do with themselves at that point in time. But it was also an education platform for, sleep hygiene and brain recovery. I also wrote a book that hasn't been published. I don't know. Do you have it?
No.
Oh,
especially not a signed copy. Well, guess what?
I'll send you a PDF of it. How about that?
Oh, I love it. That's awesome.
You probably read it in 1 hour, not an
I
hour.
know, right? So what happens when a client, does a no-show? I'm like, let's read.
There you go. There you go. Reading's great.
And I'm honored she chose to read mine.
Yeah. I think future might be another book. My future.
Yes, absolutely.
I love what I do. I think I'll always do some piece of it.
I just think we need an understanding, and I think society needs to not be so, just have so much trepidation or fear of, you have a TBI, and they pull away as if somebody has, horns on their head. Like,
right.
I'm just
trying. I think that's more societal education, right?
Yes.
Because, people fear what they don't know.
Correct.
And, they're BIA.org, braininjuryofamerica.org used to provide a lot of education. And I do it in the schools where my kids go. We talk about brain injury so they can learn about, those aspects, not just medically, but what it looks like. And if a friend has one, what that's like for them. So it's just like any mental health disease, people that are ignorant because they just don't know. And, they act in ways that, we wouldn't necessarily agree with, but it's mostly because they have no idea what they're talking about. So I think it starts with educating the population and society.
So do you have any holistic approaches to individuals with migraines?
So yes, my magnesium glycinate is a preventive medication. An abortive, you could try acupuncture.
Yeah, battlefield acupuncture. What is the difference? Like I got a PTSD acupuncture one time, and he had the things in my head, and they were the same color as my hair. So when I went like this, I poked myself
there. So battlefield acupuncture is just on the ear. That was created during the war, so they could have rapid access to a body part where they could bring down the level of pain.
Nice.
So battlefield acupuncture is specific to pain, acute or chronic, and it's a specific protocol in the ear. They're master points in the ear that basically bring down the pain. It's a brain trick.
That's amazing.
Yeah.
So I do have a question that I want you to either confirm or deny. I have some friends who they call it tinnitus or tinnitus, and what they do is they get their daith nerve pierced, and it severs the noise.
It can.
Okay. So, but that's not 100%.
Not 100%, and peripheral nerves can regrow.
Okay.
So it's possible you'd have to do it again.
Gotcha. But it does I know some people that have had them pierced on both sides, and they hurt really bad, but they were very effective for those individuals.
Right.
Okay.
Right.
Well, funny, because I was going to ask that question because I have tinnitus.
Yeah.
Although I have not gotten it pierced, and mine comes on at high when I'm under a tremendous amount of stress is when it comes on. But most of the time I can control it. But
have you ever tried sound therapy?
No.
So that's another option on your smartphone. If you go in the little search application, type in tinnitus, whatever free one pops up, download it and play around with the different sounds, and you will be surprised. Some of them may take it away. And if that is the case, just keep it on with you while you're having an episode or when you're going to bed or, something like that.
Yeah, mine's not consistent either. It's just every once in a while.
I used to hear my heartbeat in my left ear. It was so annoying when I would try and go to bed. And it was when I was stressed and I had allergies. That's another thing. Allergies can make it worse. So you can also try taking like a Zyrtec.
Okay. Interesting.
But stress is definitely up there with a call.
So much good stuff. Solution focused podcast right here.
There you go.
Right here.
I love it. So what's on your agenda next? Because you always are busy moving, shaking, speaking nationally, doing all these wonderful things.
I'm going to Louisville next week to speak at their residency program, and I'm actually teaching acupuncture there.
Oh, awesome.
Yeah.
So cool.
Yeah. That's what I have next.
I know you like contributing to like nonprofits who serve veterans, and I don't know if you're like venturing into anything like that or.
So as of right now, I call myself an advisor.
Okay. I like that.
For nonprofits that, are looking for any type of medical arm to kind of help guide them in terms of do's and don'ts or what works, what doesn't, having done that the last 5 years.
Do you like research to like be an advisor for research or?
So at the VA, I'm PI on a couple of research projects. So I do research also.
Very cool.
Yeah.
Awesome.
Yeah.
Any questions, Dorothy, or did we answer everything?
Well, I don't know if I should ask this on air, but I'm going to anyways.
You can say no. That's what's cool about Dr. McCarthy. She'd be like, I'm not answering that. Take care. Like,
Yeah. Well, no. Well, because we both know and love Dr. Dottori. So do you
Yes.
work with him too?
So yes, so he is a PhD at USF. I don't work directly with him, but I do send a lot of patients to him that I want, that I think would benefit from hyperbaric oxygen.
yeah, so we're going to have him on the show probably in about 3 weeks.
Mhm.
I think
May 2nd.
And, yeah, he's got a big launch he's doing.
I know. I'm a little familiar, but I'm not going to steal that thunder. I'll let
Don't
him.
steal his thunder. It's a big deal. So yeah, he's going to be able to share himself. So he's excited.
I
Dorothy
had
had
him.
the opportunity to meet him.
I did. He actually autographed my book for me. His book.
Oh,
So
all these authors.
I know. It's called Secrets in Depth, and it's a factional book about a Navy commander, i.e. him,
Right.
but not him. So some of the things that you're going to read this book and you're going to go, did that really happen? No, that's the fictional part. Like, so, he always has to answer those questions, but he's also the individual that went underwater for 100 days and broke the world record.
Right.
So, and I guess I asked him about the difference between him and like the guys who go around in the submarines. And he's like, well, I was able to freely swim. And that's the difference because he had the choice. Whereas in a sub, you ain't going nowhere.
Yeah. And I believe you can ask him about it, but I believe he reversed aged.
Yes.
Right?
Yeah.
Okay.
Yeah. His body age was 10 years, I think.
Like he Benjamin Button.
Yes, he did.
Really?
Yeah.
I had no idea.
He talked about that.
Yeah.
No, he talked about it, Dorothy, when we were at dinner or lunch or whatever.
Well, maybe it was just because I was like, I
You
don't know.
Dude, it's just Joe. It's all good.
Yeah.
But yes, they travel the same circles, but they don't work. Like she's a medical doctor and he's a biomechanic.
Right. And sometimes I see him at the VA in the parking lot.
What's up? Hey, we go to our appointments. And James Haley is actually one of the better VAs.
Yeah, it's a great
everybody talks smack about the VA, but James Haley really does a good job.
Yeah, I think so. There's always that saying: if you've been to one VA, you've been to one VA, because they're all different.
They are.
Mm-hmm.
The buildings look the same from the 50s, but other than that,
they have a brand new bed tower. It's gorgeous.
Oh,
it just opened, and our Polytrauma building is new too. So ours doesn't look like what you're used to.
I gotcha.
Believe it or not.
I don't get to come to your part. Nobody's given me a rating for that stuff. So maybe
you got to show it.
We'll see.
Yeah.
So anything else you want to add before we close up? Because I'm just having a ball over here.
Before I'm in total darkness, I need to find the light in here.
You're still glowy. It's okay.
I know. I look like an alien.
We can always have you back on in June or something during the daylight.
Oh, okay.
You'll have more to add because you'll be doing more cool kid stuff.
Yeah.
True.
Mm-hmm.
So where is the best place for people to find you if they wanted to connect with you?
Well, ravenhealth.com. I think it's scrolling along the bottom of the screen.
Yes, I did put it on the bottom just for you.
I do have a University of South Florida email connection. I'm at the USF Concussion Clinic. I am at James A. Haley VA. I'm the medical director of their vocational rehab program there. So if anybody's looking to get back to work and is a veteran,
we're in a hurry.
Yeah. Mm-hmm. And then I do also do medical legal at Red Medical Legal for plaintiff and defense, mostly working on life care plans for people that need, ongoing care after injury.
Mm-hmm. Cool. Very cool.
Wow. Thank you so much for coming on.
Thank you for having me.
I can definitely see why Dr. J is just like, no, we got to have her on.
I was just like, when are you available? Like,
I know. I was like, why do you want to talk to me?
Because this is amazing. You have no idea how many people you helped in an hour and 9 minutes.
Okay. Well, I'm glad.
because I'm just going to send them to the YouTube. I'm going to send my clients and be like, here, fix your sleep.
That's right.
Sleep is where it's at.
Well,
Yeah.
yeah, I have to admit I'm very bad because I'll read on my Kindle right till I go to bed. But then
Yep.
I pass out and I'm done. Like
Yeah.
I'm done. But
So I got very informative. That was amazing. Thank you. And I'll sleep when I'm dead. So, like those are the comments I'm giving.
Obviously, I mean, we all will.
jeez,
Oh, good.
Louise.
But it feels so good to do it now too.
Right?
Mm-hmm.
Imagine how much more productive tomorrow you will be if you hit REM.
Exactly. I got
Discover
my
the
little
possibilities.
dude's doing assembly about bees tomorrow morning.
Oh, awesome.
Oh yeah, and he does not know his lines.
Oh, no.
My girls have been going over it with him over and over and over. We're doing it in the car on the way to school tomorrow. I'm like, bees are important because, and he's like, I don't remember. Like, okay, we got work to do.
Oh, that's funny.
Yeah.
Well,
I was
thanks,
just gonna
Doc.
say,
You're welcome.
I did spell it right.
Which one?
Somebody just put in the comments that website goes to an ABA data collection platform.
Well, let me tell the web designer what's going on.
Thank you for reaching out to us. We will get that fixed and we'll get it in the show notes.
Let's see. The website is down. We'll take care of that.
There we go. Yes, I'm glad that we were able to take care of that so that we can get that fixed, so that more people can get help. The help that
We'll
they
put
need.
other access sites.
Oh yeah, you can give my USF emails fine too.
Okay.
Do that one.
Yeah,
That would be
all right.
great.
Mm-hmm. That's good.
The only one I have is your Gmail.
Oh, so it's Marissa, Marissa, McCarr, MCCAR at usf.edu.
Yeah. So any questions, comments, concerns, or objections? Not really, but questions or comments, I'm sure she'll take those. She's a very busy lady, but she's more than happy. I mean, she continues to serve us anytime we ask. So if I have a question out of the blue, I'll ask her and she just answers me, and it's amazing. So I'm grateful to you. Thank you so much. I don't think I would have ever hit REM without you because I never had
I'm glad you're hitting it.
Yeah, I am now with magnesium. Oh
Yeah.
my goodness. It's amazing the difference that you feel.
That's great.
Really?
I never knew it was possible. Well, I never hit REM, and I didn't know I didn't hit REM until I got an Oura ring. And I was like, oh, I just never hit this. And she's like, take your magnesium. So I'm like, yes, doc. And I did. And I started taking it religiously. And it's epic because I don't, I used to do Benadryl. I used to do Tylenol PM. I used to do all these different medications. And I cannot wake up.
Mm-hmm.
So then I'm overcompensating, taking, my Dr. Peppers, the 9 of them I drank a day or whatever, and then 8 coffees and all this toxic stuff trying to figure this out. Now I take magnesium, my alarm goes off, I get up, I'm fine.
Yeah.
I've never had that before.
Mm-hmm. And you must be getting deep sleep now.
Oh, I hit it at 33% every single night.
Wow. That's really good.
Yeah, I love it.
That's really good.
Well, there's no light sleep in my
Wow.
My head
Most
is
people have a
full.
different sleep architecture. They spend more time in light and less in deep.
Nope. Deep.
Wow.
Wow. I'll send you
That's
screenshots.
awesome.
I get more deep sleep than I do REM most days, but that's probably because I don't sleep.
No, that's good. You want more deep than REM, but the fact that you're getting more deep than light, that's really good. Wow.
Yep.
Okay. Rock on.
Well, thank you, ma'am.
I guess I will have to meditate before I go to bed tonight. Thanks to all of our guests for joining us tonight. I know we had a couple comments. We've had people come and go. So thank you. And we get a lot of thumbs up here. So thank you for joining us. And thank you so much, Dr. McCarthy, for joining us tonight and sharing your wisdom I wrote a lot of notes, and I know what I'm going to change in my routine. Thank you so much for coming on, and we appreciate you.
Awesome.
we'll have
Thanks
her
for
back.
having me. Okay.
Probably June, July time. We'll sneak her back in here because she'll definitely have some new nuggets of information. So,
Perhaps for my birthday then.
well, there you go. We can celebrate her birthday, and Dr. McCarthy will be here with us.
Sounds fun. All right. Good to
Awesome.
see you girls.
All right. Good night.
Good
Night.
night.